See if this isn't confusing. Some discomfort is normal after surgery. To minimize pain and swelling, take 800 milligrams of ibuprofen every 8 hours for the first 3 to 4 days after surgery. Take the first dose before anesthesia wears off. If prescription pain medication is given, take it as instructed on the label. Do not exceed the dose on the label. Taking medications with food or milk will help to reduce an upset stomach. Avoid drinking or operating heavy machinery while taking prescription pain medication. Do not drink alcohol while taking prescription pain medication. Pretty standard stuff. Then the next paragraph, medications. Haven't we just been talking about medications? Unfortunately, most oral surgery is accompanied by some degree of discomfort. Discomfort, yeah. It hurts. If you do not have an allergy to non-steroidal anti-inflammatory medications, we recommend taking this prior to the local anesthetic wearing off. More severe pain may require a narcotic pain medication. Narcotic pain medication will make you drowsy. Do not drive or operate heavy machinery while taking narcotic medication prescriptions. Alternate ibuprofen, 3 tablets, 200 milligrams each, so 600 milligrams, and the narcotic medication every 2 hours if needed. So I probably could be taking double what they gave me. But then I run out very quickly, so I don't know what they're talking about. Once you feel like you can stop the narcotic,
Say narwhal.
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 No.
Narcotic. Use ibuprofen and or Tylenol.
Did it say once you feel like you can stop the narcotic?
Yeah, then switch to...
How many people are on
Tylenol.
narcotics and feel like, you know what? I don't need this anymore.
Yeah, it's true. I was trying to be tough. I'm not trying to be tough no more. That was hurty. It hurts even with it. But yeah, this says you can alternate 600 milligrams of ibuprofen with the narcotic every 2 hours. I've been taking 800 milligrams of ibuprofen at the same time as a narcotic every 8 hours. That's a little much. But then they have additional information as if we aren't already very confused. Your lips should be kept moist with an ointment such as Vaseline. That's what I need. My lips are dry. Sore throats and pain when swallowing are not uncommon. Oh. The muscles get swollen and the normal act of swallowing can become painful. This will subside in 2 to 3 days. Well, we're almost to the end of day 3, right?
Yeah.
Yeah. Stiffness of the jaw muscle may cause difficulty in opening your mouth for a few days. Do not force your mouth open. Massage the muscle. It says message the muscles, by the way, but it's massage. They mean massage. The muscles and apply moist heat. But I think this is later. With upper jaw implant treatment, you may develop bleeding from the nose. This is usually a temporary finding. I think I did on the very first day. Right now my nose feels okay. Avoid blowing your nose for several days. That's why I was trying to be very careful yesterday. An appointment with your dentist may be needed within a few days of surgery to make any adjustments to your temporary denture. Your case is individual as no two mouths are alike. That was one thing, I feel like they pinched my lip in the middle, but maybe it's just because something's there. I don't know. You know that little like flap that goes down the middle of your lap?
I wonder if it's too tight or just because it's swollen,
like
or
it's stuck. But yeah, I was like, I'm gonna give it some time for the swelling.
And then ask him about it when you go in. Don't you have a follow up in like a week?
It's in April, but yeah, it's like a few weeks out.
Well, if it bothers you and it doesn't seem to get better, then we could always make an
It
appointment.
just feels like my lips a little more restricted than it was, but yeah, it's not really. We'll have to see how bad it bothers me in a few days or a week or two. But yeah, it's like, I wish everything here was like day 1, do this. Day 2, do this. But it's like, day 1, do this. Day 2, do this. And, oh, day 1, you might need to do this. Who wrote this? Probably nobody even in their office. They probably got it from some general thing.
Probably because no two months are alike, so it's different for everybody.
That's true. I'm very tired, but my mouth don't want to stop. It just keeps going. Every thought. Woo.
Yeah?
Oh man, I'm thirsty. Yeah. I got cheese.
You should show them. They didn't see it. They only see you.
Kind of hurts when it gets up in between, but or in the stitches, but I suspect because it's salty. You gotta get that little hard piece out. You don't want that out.
Finally got all the jalapenos chopped. Oh my god.
You know what would be good, but not till my mouth is healed?
What?
Some of those jalapenos in this cheese.
Jalapeno what?
In the cheese.
Oh yeah.
Look at that. So tasty. Oh my god, that's so easy. That's because we got the sharp cheddar. Very good stuff.
Ugh. Jalapenos make me cough.
Oh, my poor wife. She's struggling to breathe with that jalapeno. Poof.
They're gonna be good.
Yeah, it'll be worth it. See, when I go to swallow the cheese, some of it, I got the piece here and then the roof of my mouth here that's very sore because they cut it and ground it down and everything. And when I go to swallow, my tongue pushes up to push the cheese back, but some of it squishes in between. I'll have to rinse that out or something. Oh, but it tastes so good. It tastes so good. I think I even told my mom I have cheese. My mom was texting me last night, and I don't know if she understood how out of it I was.
She said that she could understand you just fine.
I was trying to be coherent.
Yeah.
Yeah.
You're just too cute. Can't stop looking at you. I like that smile. Look at them cute teeth. Oh, they look so nice.
Oh, they're beautiful.
They are beautiful. You picked them.
They match the bottoms.
Yeah, they look
I
good.
told him I'm not like a perfect white kind of guy. I'm kind of like a
Off-white?
yeah, you know, like because if they were, if I'm a very natural person. If somebody else wants super bright white, that's fine.
Yeah.
I'm a very natural. Also, I don't want to call a lot of attention to myself. I like to blend in. So, I went a little darker. And they did say I can always change it when leading up to
The permanent
the time I get the
zirconium.
permanent ones. Yeah. These are just for 6 months while I'm healing. So if I feel like I want to go a shade darker or a shade lighter, I can. But I think they look spot
I
on.
think they look perfect. You
That's
guys
what
comment below what you think.
Yeah.
You think they look good?
The dentist said they look good. He was like, "Whoa, these look good."
Yep, they do. They look super good.
The
You did a
lady
good job.
helping him was so nice to me. But she pushed the thing on really, like, it took some force. But she was gentle. And Candy was there. She held my hand. Yeah.
You're okay. You don't need to cry. It's okay, babe.
I'm okay.
We love you. You don't need to cry. It's
I was
okay.
watching a very good show last night.
Yeah?
This girl was going to sail around the world.
Did she do it?
She was almost done, and then I had to call it a day because I was tired.
You'll have to finish watching it and see what happens.
A big storm was coming,
Yeah?
but she was going to try and use the storm to push her ahead rather than
Hold her
slow her down. Yeah,
Oh,
it was
nice.
very clever.
That's how we should all live our lives. Don't let that storm slow you down.
Yeah, it said her coach told her, like, he was practicing with her surfing to teach her how to sail better.
Yeah?
He told her sailing is like surfing, like you can, if you just stand in front of the wave, it will knock you down. Because you can't fight Mother Nature, you just gotta learn to go with the flow.
Oh, nice. That was
And
smart.
that kind of made her think, like, there's storms coming in and they're telling her you gotta do this to slow down, or, you know, try and avoid the storm. And she was like, wait, what if I just let it take me through?
That's pretty good.
And then I turned the show off, so hopefully it works out. She was just 16 years old.
Can you imagine your daughter sailing across the ocean like that by herself?
Gosh, and she's 17. My goodness. Yeah, that's spooky. Man, the whole movie they portray her daddy is like not thrilled about it.
Yeah.
And I feel for you guy. Yeah, it would be hard.
I touched my eye.
But you'll be pretty proud of your kid doing, you know, you always get proud when they do hard things. Oh, be careful with your eye.
Too late. Too late. I already touched it. It's burning.
I'm sorry. Darn those, how, did you wear gloves?
No.
Well, we
If
got.
I would have worn gloves, I wouldn't chop my finger either, probably. Or else
We
we'd need
need
gloves.
we need to start wearing gloves.
They have gloves that are metal.
They
like-
do. I have some whittling gloves that Sarah got me.
I chopped my finger off because you didn't let me use your gloves. Look at that.
Sorry.
See?
Well, I'm glad that it's mostly still there.
It's a lot
But it
missing.
definitely looks sad. You want a kiss better?
I want it to stop hurting. Watch out! There's jalapeno on it. You're gonna get jalapeno on your tongue.
Spicy. You
Your
got
wife
spicy fingers.
Your wife is spicy.
Yeah.
I'm a spicy jalapeno.
I was feeling really frisky on this medicine. Really frisky. She was like, stop it.
Oh my god.
Oh my goodness, I'm choking on my Mountain Dew. Alright. It is a beautiful day outside.
Yes, almost all the snow is melted from the front yard.
Perfectly clear, the snow is melting. Mother Nature said, I'm sending some rain to let all that snow fade away, people.
Is that what she said?
I hope that it didn't flood at your house. If it did, I'm truly sorry. Sometimes Mother Nature just floods people's houses.
That's kind of rude.
She does what she wants.
Like you?
Yep.
Do you do what you want?
Yeah. I'm gonna eat that soup.
Yeah?
I was thinking about it at like 4 a.m. I was like, I want
You're all
some
blurry.
soup.
Oh, there you go. What happened? You went all crazy blurry.
Man,
Are you okay?
am I still blurry?
Hold on. Let me see. No, you're not blurry now.
Sharp now, huh?
You're crystal clear. Except your eyes got a glare from the window in your glasses. Now they don't.
I'll put on contact one of these days. There is so much crap on my glasses. Oh my gosh. Try not to pay attention to it. I can see through it. Earlier, I was in the window. I was soaking in the sun. That sounds really funny. And I was very sad because my sister Megan had not come to visit me. But I don't really want to visit her right now. And I don't know why I'm so sad about it. How would she even know to come visit me? I don't know.
Jalapenos are getting pretty.
I really like this medicine. I've took pain medicine before. I've not been like this. I think maybe a lot of it was just, there was a lot of emotional, I was trying to hold back before the surgery. I'm drooling. I hold a lot of stuff in.
Let it out.
Feels good to let it out.
Yeah.
Like when I was in the window, soaking in the sun and crying. Felt good. I get now when they say like a good cry makes you feel better.
You feel better?
Yeah. I feel real good right now. I feel at peace. But not dead peace. I'm
Not what?
Not dead peace. I'm not ready. I got a lot of backpacking to do.
Yeah?
Backpacking and hiking? Cody doesn't want to come with me.
Where are you gonna backpack?
Hopefully the UNs. But other places too. We got mountains just right here, not far. I wanted some food, but now I don't feel like food. Just some more.
Well, you have to call room service because the food doesn't just appear.
Bing!
The place your order. And then you gotta wait for them to cook it and bring it.
Where they have a button you press. Is that the bell on the bus? I need to stop, buddy. Bing!
That's on the bus.
You ring it. Good sir! I would like some soda! And a sandwich! You'd be like, get off the bus! Oh.
This is not the Hilton.
This is the UGA, buddy!
I can pitch perfect. Get alive.
My mouth hurts. Not too bad, but it's a It's like, what happened to us? Well, the dentist ground you down and took you apart. Did I hear him right when he said my jawbone was liquefied?
And he had to graft bone in it. It was so
It
infected.
was so infected that my jawbone would just turn to liquid.
Sounds disgusting.
I'll bet that smelled awful, but he's used to it.
Your mouth smells not great right now.
I know it tasted like roadkill last night.
Why are you tasting your own mouth?
I don't know. I breathed and I tasted it briefly.
Well, when you breathe, we can smell it.
Oh, I'm so sorry.
It's okay. We love you.
I can rinse with salt water.
Then you'll smell like roadkill at the bottom of the ocean.
Yeah. I'll smell like a dead fish. I caught a dead fish once. Candy should insert a clip of that dead fish. I was reeling, I got a bite, and then I reeled in a fish, and it was dead.
Maybe you had a heart attack.
I think what happened was I got a bite from a fish, and I went to set the hook, and that fish went away. And I set the hook, but it was in the mouth of this other dead fish on the bottom of the pond.
I wonder if the fish had a heart attack.
I wondered that too.
I mean, don't they have hearts?
I felt so bad because I was like, you can't release it. It's dead. It's floating. But I didn't want to keep it. It was like rotting. It and things stank. So I didn't know what to do.
Can you use it for fish bait?
No.
Fish won't eat fish?
Well, you can, but legally, you're not supposed to use game fish.
Why did you put
or their parts?
Legally in parentheses. I mean, in quotes. I
don't know.
Legally. For legal reasons.
Yeah. The law is you're not supposed to, in Utah, you're not supposed to use game fish or their parts. So that means you can't use a piece of a trout for bait. Or like if it had eggs, you couldn't use those eggs.
What about all the salmon eggs those people were taking? Was that just in Alaska they can do that?
That was in Alaska, and they must be allowed to do that.
They got a ton of salmon eggs.
But yeah, I thought about it because I was like, oh, I catch, in the spring, you catch a trout and it's got some eggs in it. But yeah, I guess technically I follow the rules pretty close. And I don't know why that is a rule, other than they don't want people catching fish to sell just their eggs and stuff. My nose is starting to feel swelled.
Sorry.
No, I can breathe. I don't know. Alright, I think that's enough.
Are you gonna go eat?
Yeah, let's eat some food.
What do you want?
I don't know. Those eggs were really good. But I don't know if I'm that hungry.
Have you went to the bathroom yet? You should go weigh yourself.
Yeah.
You okay?
Yeah, I'm just tired. I'm gonna weigh on Monday.
Okay.
That will be 1 week from when I weighed last. And I weighed on Monday. Surgery on Wednesday. And then I'll weigh again on Monday and we'll see the difference. I'm feeling skinny, Tony. So skinny.
So you want to eat scrambled eggs?
Yeah.
Do you want chili? Okay. Well, are you gonna go?
That chili was good.
Are you gonna go sit in your chair?
I think so. Will you come sit with me while I eat them?
Yeah, of course.
Okay.
Baby, it's okay.
Okay. Sometimes I need a lot of attention. My goodness. I'm exhausting. You're gonna need a nap when you're done with me. I want Cody to wake up and see this beautiful day, and she's sleeping.
She will wake up.
She's so sleepy, and I'm telling myself, you gotta let her sleep. She's tired. She's a good girl, but she needs her rest.
She danced for an hour and a half straight last night.
I just want to go and wake her up and tell her, look at the beautiful day, Cody.
Go ahead. Let's do it. What will happen?
She will be very grumpy.
Okay, so you already know.
Yeah. We will be patient. I see a rainbow in my mind.
What color?
It is purple and blue and orange and yellow. Just in a little spot. It's the spot where the flash is. When I close my eyes, it turns into a rainbow. I feel good. It's gonna be time for more medicine soon too.
Maybe you had enough medicine.
It's possible. What did I have last? Tylenol, right?
Yeah, at 9:30.
9:30.
Why don't you?
Just a little bit.
Why don't you? Here, I'll take your trash.
My mouth is rubbery.
And then you go downstairs and watch to see if that girl makes it. You okay? Are you okay?
I got excited because, I gotta go finish my show.
All right, and I'll make you some food.
What is it called? It's like True Hope or True Spirit or something like that.
Where's it at?
It's on Netflix.
Okay.
And she sails in a pretty pink boat. And it's just a little fella, but it's cute. And she said, dude, she crashed it, and they wanted to give her a different boat. And she was like, I want to sail in pink. She called it pink because it's pink. It's a lovely sailboat.
Okay.
Okay, I gotta
go eat. Go. What?
I gotta go watch my show.
And I'm gonna make you eggs.
Okay. I need another soda.
Okay, I'll bring you a soda too.
There's a Sprite downstairs, but I don't really want a Sprite right now.
What do you want?
Cherry Coke.
Okay, I'll bring you a cherry Coke with your eggs.
Thank you. Oh, should I take my pills down? I'll take them down so I have them. I'll probably be down there a while, huh?
Probably most of the day.
Cephalexin.
You love that
like
one.
Furry mold.
You love cephalexin. I call it cephalexin.
9:30 to 10:30? Wait, what time did I take the Tylenol?
9:30.
30, 11:30, 12:30, 1:30, 2:30, 3, 5:30. I'll bring it down.
Okay, I'll make your food.
Alright, thank you so much.
Hold the railing, please.
I'll lean a little.
Yeah, definitely lean.
Nice and slow.